Hello. Do you think that pets should be spayed or neutered at young ages, the same way that I was taught when I graduated veterinary school back in 1991? Well, for years, most of us in the veterinary profession thought absolutely spaying and neutering was healthy for our animals, preventing all sorts of diseases and cancers, and it should be done as early as possible. The typical age was around 6 months for a long period of time after animals finished their shot series and wormings and that kind of thing. But did you know that actually early spaying and neutering is one of the more harmful interventions we do for the individual pet? Now, I'm not talking about uh, animals in the shelter or the rescue groups or the humane societies. Those animals, they're looking at what's called herd health, and that's looking at population dynamics. In other words, there certainly are so many unwanted and overpopulated dog and cat populations where animals are being euthanized or neglected. And so in the shelter or rescue business, certainly spaying and neutering is a part of that herd health management idea. However, when you look at the health of the individual animal, there's been increasing data and evidence and research over the past several decades about so many chronic health conditions that are actually due to removing of the sex hormones. So when clients come to me and ask me, hey, doc, should I get my pet spayed or neutered at a young age? And I say, absolutely not. The evidence is showing that significant amounts of chronic disease, ranging from hormonal diseases, such as diseases of the thyroid gland, the adrenal gland, and diabetes, um, those diseases are significantly increased in the neutered or spayed animal because when we remove the sex hormones, estrogen and testosterone, we actually affect the whole endocrine or hormonal systems of the body, since these systems function in an integrative unit. These are what are called messenger molecule hormone. They're hormones that communicate amongst each other. So when you remove the sex hormones, you're affecting the pituitary gland, the adrenal gland, the thyroid gland, and the pancreas. And that's why we see tremendous stress on these organ systems. And then we end up with diseases of these organ systems. As I said, diabetes, thyroid problems, Cushing's disease in the dog. So a lot of these have to do with removing the sex hormone. The health of the bones and joints is also critical for maintaining the sex hormones. I don't know if any of you have seen an intact, male or female dog. Their conformation is totally different from early spayed or neutered animals. In fact, animals that are, spayed, their conformations are certainly affected. We see problems with the joints, such as increased hip problems and stifle or knee problems. One of the things we see is an incidence of ACL tears, which was a disease. That's a disease where they're tear in the cruciate ligaments or the menisci that make up the knee or the stifle joints. And that's significantly increased when the sex hormones are removed in our animals at a young age. So certainly bone and joint problems. Cancer is actually the opposite in most cases when we remove the sex hormones, especially at an early age. Cancers like bone cancer, especially prominent in large and giant breed dogs, a cancer called hemangiosarcoma, which is a tumor of the blood vessels. That's another common cancer that's very aggressive and malignant, especially in large breed dogs. And even prostate cancer. When I was taught in veterinary school to neuter animals at a young age, I was taught you were preventing prostate cancer. But in my 30 plus years of clinical experience, I haven't seen a case of prostate cancer in an intact male dog in all of my experience in my career. It's typically seen in the neutered animal. Now, with females, spayed animals actually aren't going to get what are called uterine infections or pyometras, but that is a very treatable condition once it's detected. And while it can make animals ill, spaying does, take care of it. However, when I teach and preach in my practice a more holistic preventative healthcare model, in other words, less vaccines, species appropriate diets, less wormings and pesticide use in the animals, and flea and tick and heartworm medicine, I rarely see pyometras in my population in my clients' animals. So, again, uterine infection is a rarity. The other issue of breast cancer is a mixed bag. Most animals, most dogs that develop breast tumors we actually, about 60% of them are in the benign category, and then about 30 to 40% can technically be called malignant. But again, just like any cancer in the body, it's a multifactorial issue. And so it's not just removing the sex hormone, it's not just the presence of sex hormones, it's lifestyle, it's stress, it's toxins, of which I just mentioned a minute ago in terms of preventative lifestyle. So the issue around breast cancer is a little bit more complex than just a sex hormone issue. So if you do decide to spay or neuter your animals, you want to wait until they're at least sexually mature, which can be anywhere from 18 months to 24 months, depending upon the size of the breed of the animal. With cats, it's a little more challenging because we have to wait. With cats, they tend to mark their territory, go into, males tend to mark their territory, females tend to go into heat repetitively. So it can be a little bit annoying to deal with an intact, kitty. So, if you can hang in there till about a year of age, you'll still get some health benefits. And actually, early neutered or spayed kitties are much more prone to urinary tract disorders like blockages in the male cat and the development of crystals, and in female cats as well. So again, we want to try and wait as best we can. Kitties also are much more prone to weight gain and diabetes, again, because of the removal of the sex hormones and the effect on the thyroid and the metabolism. We will see animals develop, weight-related diseases like diabetes and obesity. And finally, behavioral issues in our animals. People are often taught, I need to neuter or spay my animal because it needs to calm them down. But actually, a lot of the data shows that especially early spaying and neutering, that actually will lead to an increase in anxiety and aggression in animals, fear-based anxieties especially. Now, intermale aggression between two intact male dogs, of course, is going to be a little bit more increased when they're intact. But most of the other types of aggression that behaviorists actually categorize, or behavioral issues like anxiety, that actually is significantly increased when they're neutered or spayed. So one of the most important things you can do for your individual animal is to preserve those sex hormones for as long as possible. With male dogs, in most cases, unless there's a chance they might actually have an unwanted pregnancy with a female, I actually don't recommend neutering them at all. And with females, we can actually make the same argument, but as I said, with the rare exceptions of pyometras and occasional breast tumors in female. The wave of the future, actually, with young veterinarians being taught in veterinary school and out in continuing education, is to actually do sex organ sparing sterilization. What we mean by that is by doing vasectomies on male dogs and actually doing hysterectomies on females. That way we preserve the sex hormones and we still actually prevent unwanted pregnancies and contributing to the overpopulation problem. My name is Dr. Michael Dim, and I'm a holistic veterinarian here in South Florida. And I offer both in-person consultations in my home and in my clients' homes, as well as nationwide phone consultations, which I provided over the 25 years. Thank you very much for listening to this informative video.